Hello, Emily.
Hello, Samuel.
It's nice to be here in Thunder Bay with you.
It's very nice to have you here.
Um, could you please make a little introduction about yourself?
I sure can. My name is Emily Hampton. I have born and raised in Thunder Bay, Ontario, Canada. I've always had a passion for nursing. I've been nursing for 10 years. I know, I look very young. I finally found my passion in community health nursing.
Great. And you have been using our system for a year now,
hmm
and you know very well that in 73 health system, doctor can be 100 kilometers away from the patient.
Yes, I sure can.
Yeah. So could you share, please, your thoughts on this model, where the nurse and the patient are in the same location, and doctor is joining from over the internet?
So far, I've used it in a clinical setting. I've connected with nurse practitioners and physicians in Toronto. I have never had any issues in connecting with them, and we can do about 80% of an appointment through this system that could be done in person. So that's huge.
Yeah. And what you think about the quality about the system?
The quality is pretty fantastic. The patients are really happy, and so are the doctors. They can, and the nurse practitioners, they can better assess clients through our cameras than the regular telehealth medicine that has been usually been used. It's better quality is better patient outcome because they can better assess for things. I've never seen an ear as clear as this system. I've also never seen a throat or heard a heartbeat as good as I've heard a murmur in your heart.
Yeah, 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 yeah. And do you think the presence of the nurse is always necessary, or what do you think about the whole setup about nurse helping
I highly
patients?
encourage if you can get a nurse to be present, to get a nurse there because again, quality, they know how to use the system a little bit better. They have more of a healthcare background. But you don't need to be a nurse to work the system. You don't need to have a medical background. It works pretty easy. I've taught my mom how to use the system, my dad how to use the system. My dad works in a paper mill.
Yeah,
I've also taught my brother who's a plumber. Um, it would really, if somebody at home, say, is passing away and a family member was there 247 and the system was there, we don't have to make those patients uncomfortable and bring them to a clinic to be assessed.
yeah. Okay. And how do you see the usability in Canada?
Usability, this could be huge in First Nations communities. This would prevent a lot of flyouts.
Yeah, yeah. And any thoughts about the challenges in Canada?
The challenges in Canada is the logistics and the politics, because I don't know why Canada is so afraid of change and technology, but we are.
Yeah. Thank you very much.
Yeah.
73 Health, remote health diagnostics for healthcare units, workplaces, and homes.